A very good evening and welcome to one and all present here for international webinar series on DENTOPHARM 2022 on title Interferon Gamma on Human Dental Pulp Stem Cell Behavior. I am Dr. Ramya, part of Dental Education Unit and Senior Lecturer at Sri Balaji Dental College and Hospital. Will be highlighting you about this program today. I would like to welcome our chairperson, Dr. Sri Nisha ma'am, Registrar Dr. Bhuminathan sir, Principal Dr. Jimson sir, and Dr. Sumati Jones ma'am, Head of the Department of Pharmacology at Sri Balaji Dental College and Hospital. Over to Sumati ma'am to share a few words on today's webinar.
Good evening. As you all know, our webinar is based on multidisciplinary research area. Today, we have our eminent speaker, Dr. Krishnamoorthy, who is well versed in biochemistry as well as endocrinology. Welcome you, sir. Dr. Krishnamoorthy, sir, is well versed in biochemistry as well as endocrinology. He is a great friend of mine. He'll be discussing today about IFN and stem cell behavior. Over to Ramya about sir, please.
A little announcement on housekeeping before we get started. So if you have any queries during the presentation, please type the questions in the link provided in the comment box. After the presentation, we will have time for questions at the end. Now, I warmly welcome the guest speaker of today's webinar, Dr. Krishnamoorthy, who is an Associate Professor in Department of Medical Biochemistry College of Health Sciences at Davidolo University, Ethiopia. He is an alumni of University of Madras, from where he obtained his Master's in Biochemistry and PhD in Biochemistry Endocrinology and Dr. ALM PG IBMS. He has experience in teaching and research over 11 years, and his field of interest is on molecular biology, reproductive biology, diabetology, cancer biology. Earlier, he was reader and head of the Department of Biochemistry in Rajas Dental College and Asan Memorial Dental College. He was also awarded Best Teacher Award in 2017 and Rajiv Gandhi Gold Medal National Award for Individual Outstanding Achievement in 2013. Dr. Krishnamurthy has publication index including 33 in PubMed and 8 in Scopus. He also has 1,598 journal citations and 25H index and 31 I-10 index. He is president of All India Association of Basic and Paramedical Sciences and a life member of Society of Reproductive Biology and Comparative Endocrinology. Today, his expertise is titled on Interferon Gamma on Human Dental Pulp Stem Cells Behavior. We welcome you, sir.
Okay, thanks, ma'am. Thanks for your introduction. Respected heads of the administration of Sri Balaji Dental College and Hospital, head department of pharmacology, and faculties of Department of Pharmacology, and participants of this webinar. Really, I'm very happy and proud being a part of this webinar. Actually, Professor Sumati asked me to deliver a lecture on this webinar. Before that, I told her, because I'm belonging to biochemistry, so how is it related to pharmacology, like that I asked. She asked me to something relevant to your dental field, at the same time to pharmacology. That is what has selected this topic. Interferon gamma regulates human dental pulp stem cells behavior. Okay, interferon gamma regulates human dental pulp stem cells behavior. Actually, this is a topic. Before starting this one, I'd like to talk about the importance of this topic. As a dentist, you know very well about a dental pulp. Here, what we are going to do is, from teeth, extracted teeth, we can collect the pulp and we can convert this as a human dental pulp stem cells. The advantage of this human dental pulp stem cell is This may be differentiated into any cell type like chondrocytes, adipocytes, and neurocytes, osteocytes, odontoblast. It may be anything. So that is what it's very, very important in regenerative medicine. Because of this, we are giving this much important to this. Because other stem cells is not easy to isolate. This cell is very, very easy to isolate. At the same time, what is it? We can get so much numbers of cells from this pulp. And in addition to that, another cells also, stem cells also, we can get it from tooth, that is shed. A shed, this is the abbreviation. How can we expand this one as stem cells from exfoliated tooth? So that is what actually we are concentrating. However, this human dental pulp stem cells attracting the researchers to do this, to take this, to select this. And I must talk about interferon gamma also. This interferon gamma is one of the regulating factor, because in regenerative medicine now we can use this one. We can convert this DPSC into any other cell. The only problem is, coming to the application, this interferon gamma plays a vital role in controlling this differentiation. That is what we have to study about this one. Already so many studies were conducted. I'm going to show so many results which is related to this topic. Okay, let's start. You know very well, dental caries is a chronic infectious disease. How this dental caries is caused is, as a biochemist, I think I can explain this one. Anaerobic glycolysis is conducted in microorganisms like Streptococcus mutans, where glucose is converted into lactic acid. This lactic acid can erode the enamel of the teeth or tooth. So that is what's happening. Then dentin will be affected. Finally, it can spread up to pulp also. Because of this, root will get affected. Then so many things will happen, which can lead to the demineralization of enamel because of lactic acid. Same thing happened to dentin, subsequent pulp tissue injury. Pulpitis is an inflammatory disease, infection in pulp, which occurs when the infection of caries-related microorganism penetrates, like Streptococcus mutans, the dentinal tubules and into the pulpal tissue. Imagine if pulp is affected, then what will happen? You know very well. During the inflammatory phase, then inflammation will be caused. The pulp tissue reacts to bacterial irritants via innate or adaptive immune responses, thus releasing a range of chemokines and pro-inflammatory cytokines. Actually, inflammatory molecules are produced to heal the damaged cells or damaged pulp, but the thing is, sometimes adversely it can stimulate the effects. Dental pulp stem cells or mesenchymal derived cells characterized by self-renewal. Themselves, it can get renewed if you provide enough quantity of the medium to promote the differentiation or proliferation, and multilineage differentiation, including chondrocytes. Apart from odontoblast formation, this can be differentiated into chondrocytes. This chondrocytes means it's responsible for cartilage formation. Adipocytes, this is responsible for adipose tissue formation to store fat, and even neuronal. Neuronal cells also can be what is that synthesized, formed from or derived from DPSs. At the same time, osteoblast bone cells also formed from this one. Apart from odontoblast, this DPSC can be differentiated into this much cell. That is what it's very, very important in regenerative medicine. Establishing them as an attractive choice for tissue engineering and regenerative medicine purposes. Yes, of course. Numerous studies have demonstrated that DPSs have the potential to generate dentin and pulp tissue. Here, we must be very alert because this is going to generate dentin. It's going to generate pulp tissue. You people are usually doing what is that RCT. By the time you are removing everything, then you are filling with the cement or something. Here, what's going to happen is we can regenerate the pulp. That is very, very important. If you regenerate it, imagine the again you can create a real tooth again. Okay, so in this way, it's very, very important. This is the main aim of our topic. Under appropriate environmental conditions, simply this won't happen because we have to provide growth factors for further proliferation. At the same time, there is no differentiation, there is no requirement of differentiation here because already it's a odontoblaст. So at the same time, we have to control the proliferation by what is that administering few cytokines, or sometimes there is a necessity to inhibit cytokines, or that is a inflammatory or pro-inflammatory factors. So that is what now we have to discuss about interferon gamma, role of interferon gamma on dental pulp stem cells. Here you can see the picture in this, what is that, cells are there. This first one, A is there. This is the freshly isolated cell. We have to take the tooth and we have to collect pulp cells. Then in the same day, we can take this photograph because it's not adhesive. It's not adhesive, what is that, attached with the cell culture plate. So this you can't see any cells here. And coming to D picture, this is the same cell. We didn't add any medium. We didn't add any odontogenic medium. We didn't add any osteogenic medium. Simply this one is what is that? 14 days. After 14 days culture, we can see this one because attachment is there with the cell culture plate. That is what we can see the cells. This is the odontoblast. Here, what's going to happen is this in this bottom, in the same 14 days, what is that? The odontogenic medium or osteogenic medium were added, and this first one is what is that? Osteogenic medium. Here you can see the cells without staining. In the same day we are doing, what is the difference between this D and E is, this one is with osteogenic or odontogenic medium or adipogenic medium. But in this, you can see this is the with staining agent. This is with staining agent. The same 14 days old, but we have added osteogenic medium, and in this the same osteogenic medium were added and incubated for 14 days like the same thing, and finally we have stained with alizarin red. So here we can see the red. Why we are staining with alizarin red? This staining agent is responsible to characterize the osteogenic cells. Coming to this column here, this one is actually adipocytes. Here you can simply see the number of cells and the same 14 days cells with adipogenic medium. This is incubated for 14 days. This one also the same thing after incubation period, that is after 14 days, then we have to stain with oil red O staining. Here we can see we can characterize very easily what is that. This one is adipocytes. So basically it's collected from what is that term? This is basically, this is a DPSC, dental pulp stem cell. Here 14 days we have cultivated and it's attached with the plate, culture plate. Then we are converting this dental pulp stem cell into bone cells and also adipocytes. So this one is having this much capacity to differentiate. In future also you can culture and you can convert this into any other cells and you can supply to any what is that regenerative medicine laboratories. And this one is the characterization, second characterization. Here you can see very easily this one. Okay, we have stained with so many fluorescent dyes. First one is a negative control. This control is negative control because we didn't add any antibody or any, only we have added fluorescent dyes only. Here we have added antibody against to CD146, CD90, CD105, and CD20, CD29, CD34, and CD35. Sorry, CD45. In which very easily we can see this up to this from CD40, 146 to CD29. We can see the this one is with this negative control with 0.3%. Sometimes this may give what is that, unwanted fluorescence. That is what the 0.3%. We can't consider this one. Okay. Coming to this one up to CD29, almost 89 to 99.4% was there. So these factors are responsible for the proliferation of the stem cells. So, because proliferating capacity is high to dental pulp stem cells, so that is what it's getting proliferated. Coming to the CD34 and the CD45, they are not present in these cells. Almost this is also we can't consider 0.8% and 0.6% only, so we can omit this one. And the second one is interferon gamma proliferative capacity. How it is effective? Just we have to see. In previous slide, just we have characterized the dental pulp stem cells. In this slide, we are going to take interferon gamma and going to treat the cells with the same thing. Simply, interferon gamma, we can't tell always it doesn't have effect. On the other hand, we can't tell it may have effect. Based on the dose only, it's it's controlling dental pulp stem cells. So finally, we can conclude that dose dependent effect will work out in dental pulp stem cells. So we have taken 5 different doses of interferon gamma. It starts with 0.05 nanogram per ml. What is this one is, if for example, if you take blood, just we have to calculate per deciliter. You may have aware of glucose level, for example, 70 to 110 milligram per deciliter. Deciliter means 100 ml. Here, just we are calculating per ml. This ml denotes the ml of the osteogenic medium or odontogenic medium. So here you can simply see this one, 0.05 nanogram per ml. Next dose is slightly we are increasing 0.5 nanogram, 5 nanogram, 50 nanogram, and 500 nanogram. Totally 5 different ranges of levels of interferon gamma were taken and they've checked. Here, this what the x-axis denotes the, for this only I'll explain. Remaining thing you can follow very easily. This denotes the cell proliferation. Actually, for cell proliferation, we can check it by MTT assay. This is the best assay to check the viability. At the same time, it's a best method to count the cell numbers also. Here you can see this first bar denotes control, and the second one is this is negative control. Second one is with low dose starts from 0.05 and 5, 50. What is that? 0.5, 5, 50, and 500 nanogram per ml. So they have checked in different days. First day they have checked, and day 3, day 5, and day 7. From this, you can easily see this one. Okay, so cell numbers are huge in 7th day, not in 1st, 3rd, and 5th. It's huge in 7th day. Here, very simply, you can see the low dose of interferon gamma supplementation along with medium. It's increasing the number of cells. Which cell? This one, dental pulp stem cells. So here, low dose is increasing. If you are increasing doses from 0.05 to 500 nanogram, gradually it's decreasing the growth of the dental pulp stem cells. From this, we can consider low dose of interferon gamma is having the capacity to increase the cell number, especially DPSC. From this slide itself, we can't conclude because there is a problem, because in upcoming slides, you are going to check. Again, this point not 5 will be a negative one. We are going to see that also. We'll see. In our previous slide, 0.05 is the effective dose to increase proliferation of dental pulp stem cells. In this slide, we'll check. Here, we have actually the researchers have taken four different in the study. They've taken four different groups. First one is control. Second one is interferon gamma. Actually, they've taken cell and plated on the plate. Plated in the culture plate, and finally they have kept it for 24 hours. And what they've done is they have treated with the interferon gamma with 0.05 nanogram, 0.5 nanogram, and 5 nanogram finally. Actually, they have omitted 500 nanogram because that is not what is that, acting perfectly, because it's reducing the cell number. So they have selected first three doses, 0.05, 0.5, and 5 nanograms. Here we can see this one. Actually, this first study, they have stained the cells with EDU. Actually, this is the fluorescent staining agent which is responsible to stain the proliferating cells. If there is no proliferation in the cell, it's not possible. Only proliferating cells will be stained by this EDU. Here, in control, very minimal proliferating cells. Anyhow, cell line means surely cells can be proliferated, because the DPS is a stem cell, themselves it will be regenerated. Already we studied in previous slide. Coming to second one, this one, interferon gamma 0.05 nanogram per ml is stained more when compared with higher doses like a 0.05 and 5 nanogram per ml. So proliferation is higher in this 0.05 nanogram per ml supplemented cells, cell plates. Second row denotes the DAPI. This is the staining agent, fluorescent staining agent responsible to stain DNA. It won't bother, but the staining agent won't bother about whether the cell is undergoing proliferation or not. It won't bother about anything, but simply this will stain the DNA. Anyhow, this is almost equal in all the things because number of cells, based on number of cells, and staining will be increased. That's all. If it is less, this will be decreased. So then what happened is here, in the same focus, they have merged the EDU fluorescence and DAPI fluorescence. So this is possible by fluorescent microscopy, and sometimes if we can go for live imaging by using confocal microscopy, and we can overlay. This is taken by a fluorescent microscopy. Here we can simply see. By merging, this red is merged with this blue, and it creates pink color. Simply we can say so we can see so many pink color here. So that is what we are seeing. In which one it's higher is in 0.05 nanogram per ml supplemented interferon gamma treated cells, it's higher. So it means that 0.05 nanogram per ml interferon gamma is increasing the cell number, is increasing the cell proliferation, but it is not in 0.5 and 5 nanogram per ml. Now it's proving the previous study. Coming to next slide. The effects of interferon gamma on migration of DPSC. So before that, we have concentrate on proliferation. Now, just we are going to check. Now we have to check the migration of the DPSCs. Then only this is possible to form tissue formation. Already we checked, yes, it's proliferating. At the same time, it's possible to differentiate into other cells like adipocytes and other cells like osteoblast. Now, what is that? We are going to study about migrations. If migration is good, then we can believe the cell line, because this may generate tissues. Then we can use it for tissue engineering. That is what we have to study this also. Simply, you can see here, actually the migratory cells were stained with crystal violet staining agent. There are two chambers. Okay, there are two chambers. Actually, while culturing, this will move toward from in to out, out to in. Okay, so this is the migration. If it is moved, then what migration is good. So we can understand. Here also we can simply see. I'll explain this one alone. The graph is same thing. Here we can simply see in zero point 0.5 nanogram ml, migration is good. Before that, we studied in zero point zero 0.05 nanogram per ml only, proliferation is good. Again, it's confusing whether should we select 0.05 nanogram or zero point 0.5 nanogram. So we can't take 0.5 to increase proliferation because it's not effective in migration. We can't take zero point 0.5 for what is that this one, because zero point 0.5 is less in proliferation, zero point 0.5 is good in migration. So again there is a confusion. So this is happening in the what is that migration study. Then coming to the differentiation study, again we have to check the differentiation for in both Waranto and osteo. You can simply see here, actually this is with alizarin red staining agent, because basically they have calcium, that is what we have stained with alizarin red. See this one. Here this one control 0.05 interferon gamma with 0.5 and finally 5 nanograms, in which simply you can see, again it's confusing. See here. Okay, by visually we can see our so many cells are here in interferon gamma 5 nanogram per ml treated culture plates. So this is the focused picture. Here so many cells are there, and the problem is 0.05 and 0.5 nanogram per ml interferon gamma is decreasing the cell number drastically. It's decreasing the cell number. Okay, based on cell proliferation, we have selected 0.05. Based on migration, we have selected 0.5. But based on differentiation, 5 nanogram per ml is effective. So imagine this much variations are there because interferon gamma is doing its function in different way. We thought a 0.5 or 0.05 or zero point 0.5 is effective, but the problem is it's drastically reducing the cell number. Based on that, if you select, again this will be reflected in differentiation. We can't use this. There is no use in regenerative medicine. So again, it's suggesting 5 nanogram per ml. So what it means is, this is not a problem with interferon gamma alone. So there is a problem with other factors also. That is what again studies are going. So the research has concluded that this is not only because of this one, some other factors are interfering with this. What all the factors can interfere with this? Okay, to find out the answer, they have conducted this study. I'll explain this one. Now you can see this graph because it's very, very important. In control, negative control, what is that? We have taken this value and we have to compare with this one. See here in 0.05, cell number is very less. In 0.5, little excess when compared with the 0.05, and coming to 5 nanogram, it's more than 0.05 and more than 0.5 nanogram per ml. So now for differentiation, this dose, that is a 5 nanogram per ml, is effective dose. So with this, they have selected this one and they've conducted this study here with to check the influence of other factors with interferon gamma role on dental pulp stem cells. Can you see here? Because in this study, 5 in this study, 5 nanogram effective, and in previous study, this one is effective. The researchers selected this dose as a optimum dose, 0.5 nanogram per ml. See here in this study, they have selected only 0.5 nanogram. Here also the same thing. Just this is the graph, this is the image diagram. That's all. Okay. Coming to this one, and this we can see control. This one is negative control, and interferon gamma with zero point 0.5 milligram per ml, and they have used PTDC. This one is the PTDC means this is the inhibitor of for NF kappa B. This is the inhibitor of NF kappa B, and this one is the inhibitor of another factor, that is the ERK. This is also one of the signaling molecule, and another signaling molecule. This one is the SB and the SP. They are responsible for MAP kinase regulation. They may inhibit MAP kinase. So, what is the relationship between NF kappa B and MAP kinase and ERK is because obviously interferon gamma can regulate these factors. What they're doing is, apart from supplementing interferon gamma, they are planning to control this much factor. Then they wants to see the result. See here, coming here. Otherwise, first we'll check the image. Okay, simply visually we can see in 0.05 mg per ml. It's a little okay, not too much less. Little okay. Coming to what is that? PTDC inhibition. That is inhibition by PTDC, because it's going to inhibit NF kappa B. So we can call this PTDC as NF kappa B inhibitors. See here, in this one, what's happening is the cell growth is, cell numbers are very good. Differentiation is very good. Coming to this other MAP kinase inhibitors, this U0126 and SP600125, they are not effective in the study. For differentiation, if we inhibit MAP kinase by using SB203580, the differentiation is good. So based on this study, they have concluded that that is what graphically they have given. The final one, and this one is PTDC and SB203580 inhibitors are excellently working in differentiating dental pulp stem cells. So from this study, we can conclude that pharmacology is here only. Based on this study, we have to design a drug, we have to administer a drug, thereby we can control dental pulp stem cell differentiation. Thereby, in regenerative medicine, we can use this as a novel drug. Okay, so we have to, this will give a basic idea to develop the drug. So that is what we have to work more, and then only it's possible. Simply people are what is that, hearing these concept, stem cells are there to regenerate the organ. When it is possible, everything should be studied thoroughly. We have to control the cytokines, especially interferon gamma and other pro-inflammatory factors and anti-inflammatory factors. Then only it's easy to use our use this cell lines in regenerative medicine or tissue engineering. So different studies demonstrated that low concentration or optimum concentration of inflammatory cytokines, IFN gamma, can stimulate the proliferation and the migration of human DPSCs, dental pulp stem cells. Okay, with this I'm completing. If there is any question, please ask me. Thank you, Ponamak.
Thank you, sir. We'll move on to the question session now. There are a
Please,
few
ma'am.
questions from the students. Actually,
Okay.
sir, the students cannot, we cannot see the students, but they can
Okay.
ask questions through the comment box.
Okay. Where is it, madam?
No, I have the Excel sheet. I'll ask the question from that, sir.
Yeah, it's there.
Yeah.
On right side,
Yeah.
it's there. I think.
Yeah,
Okay.
they have posted few questions. Will interferons interfere with the key pathways?
Actually, interferon gamma usually is having two receptor. One is interferon gamma 1 receptor and 2 receptor. Obviously, it can upregulate MEC. Thereby, it can control MAP kinase pathway. Thereby, it can activate ERK. Finally, this can increase the cell proliferation. Though that is what it's happening. That is what interferon gamma is does, increasing the cell number by proliferation.
Okay, sir. Is there any role of interferons in TB?
TB means, are you asking about tuberculosis?
Yeah, tuberculosis.
Ma'am, actually,
And
in
also,
all, because this interferon gamma is produced by leukocytes, we know very well in tuberculosis, any of all immune cells going to be controlled. So obviously, the role must be there. I'm not
okay, sir.
expert in tuberculosis.
Okay, okay, sir.
Okay,
Do we
must be there. No change in that.
Yeah, okay, sir. Is there, how do we counteract the toxicity induced during this therapy, sir?
What, ma'am?
How do we counteract the toxicity induced during this therapy, pulse therapy?
Ma'am, actually, now, right now, we are not bothering about toxicity. Just we have to find out the drug. Then only we must bother about toxicity. Still, it's an what is that? It's an research only. That too in vitro. We have to move towards the in vivo with animals. Then only we can check, ma'am. We have to bother while going for clinical trial. We should bother first. We have to find this one. Based on that, we can have so many drugs. Then we can check which one is the less effective, which one
Yeah,
is
okay,
having a side effect with less adverse effect. Later, we have to
okay,
do that, ma'am.
okay. So there was one more question also. Does
Okay,
it have
please, ma'am,
any
please.
reduction in the cancer therapy, cancer chemotherapy?
Ma'am,
It was
actually, I
apart from
told
the
you. Yeah, yeah,
pulse
yeah. Oh,
therapy.
nothing,
Yeah.
nothing. The actually stem cells or cancerous cells will behave similarly. The only difference is cancerous cell will not get differentiated into another cell, but the stem cells will be differentiated. This is the main difference. Then, what is the similarity? You can ask me. Their cell proliferation rate is very high. So this is the similarity in proliferation. Surely MAP kinase pathway will involve. If MAP kinase is involving, ERK will involve, MEK will involve. Obviously, these inflammatory molecules will involve, cytokines will involve. Obviously, our interferon gamma also, no doubt about it. Maybe here
That's
we are telling the maybe for cancer, if what is that? This may work out like this. For example, higher doses of interferon gamma is inhibiting the proliferation. Am I right, ma'am? Because I have discussed the four doses previously. 500 nanogram per ml is inhibiting the cell proliferation. This higher doses of interferon gamma may inhibit the cell proliferation. Thereby, we can use this drug for a cancer treatment also, along with the MAP kinase inhibitors and activators. Yes, ma'am.
okay, sir. Thank you, sir. That's all from the
Okay.
question part. Thank you so
Okay.
much, sir. Thank you so much for your presentation and sharing your knowledge on pulse therapy. And
Thanks for
I
the
also
opportunity given by Department of Pharmacology, especially Sumati Jones, madam, and Ramya, madam. Thank you so much, ma'am.
thank you, sir.
Okay,
I
thank you.
would also like to thank the institution Sri Balaji Dental College and Hospital and Dr. Sumati Jones, ma'am, head of the Department of Pharmacology, for conducting the webinar, Principal Dr. Jimson, sir, and the organizing committee, Dr. Satish and N.P. Murli. Special thanks to Dr. Nishad Sheikh and Angelin from DocMode organization for the technical support.
Okay,
Thank
ma'am.
you.
Because I don't know how he's organizing. Okay, myself also very thankful to organizing team. Thank you so much. Thank you once again. Thank you.